This video will explain the facts about glaucoma and give an insight on effective management of this disorder. It will also provide useful tips to lead a normal life living with glaucoma. Let us begin with learning more about the disease and carefully listen to some useful experiences shared by patients themselves. Mr. Om Prakash Khanna is a successful architect for the past 20 years. He is dedicated to his work and is extremely conscious about it. He is living a normal life with glaucoma from the past 4 years.
Mrs. Shobha Natarajan works in a multinational company as a personal assistant. She also designs embroidery on premium clothing in her free time at home for additional income. She is suffering from glaucoma for 2 years now.
I was leading a perfect life before I was diagnosed with glaucoma. For some days, I was having blurred vision with some headache. So I went to get my eyes checked for glasses. I was extremely worried when the doctor asked me to undergo some diagnostic test immediately. The report said that the pressure in both the eyes was 34. I was told that if not treated early, I would lose my vision completely. This came to me as a shock and I was upset.
It is estimated that more than 12 million people are affected by glaucoma in India. This constitutes 12.8% of the total blindness in India. Glaucoma is often called the sneak thief of sight because it can cause blindness with few or no symptoms. People with a family history of glaucoma, those who are diabetic, previous eye injuries, or who are regular users of steroids could be primarily at risk for glaucoma.
Though the disease is blinding, it can be treated if detected early enough. One of the best methods of managing glaucoma is to successfully lower the pressure inside your eye, known as intraocular pressure or IOP. To understand how increased eye pressure can lead to vision loss, it's important to learn how the eye works.
Your eye produces a clear liquid called aqueous humor to protect and provide nutrients to tissues in the front part of the eye. In a healthy eye, this liquid drains out through canals at the top and bottom of the eye. For a patient who has glaucoma, this liquid may not drain out properly. Aqueous humor buildup has been shown to increase the pressure inside your eye. Too much pressure backs up like a clogged drain and may damage the optic nerve. This damage can lead to vision loss.
Expert opinions based on recent studies have further confirmed that the more your eye pressure is lowered, the better the chances of maintaining your vision.
Glaucoma can be a symptom-less disease. This means that even if your eye pressure is too high, you may not physically feel any difference. But increased eye pressure can still damage the optic nerve at the back of your eye without you knowing it. If optic nerve damage increases, instead of seeing the whole picture, the top, sides and bottom area of your vision may gradually blur and eventually darken. These changes are permanent and may lead to complete blindness.
I can fairly remember that my grandmother and uncle had glaucoma. They had to lead an extremely miserable life when they lost their sight completely. When I was first diagnosed with glaucoma, it really scared me. Losing my sight completely, I thought would be just awful and terrible. The things I do in my life, I would no longer be able to work in the field I am now. I would no longer be able to see my children grow up. Doing my side business, it would be very difficult as I have to sketch precise designs of embroideries for premium clothings.
While glaucoma is not curable, it can be controlled if detected early. Today, detection and investigation of glaucoma can be done using technology and devices which either aid in measuring the pressure or directly inspect the status of the optic nerve situated at the back of the eye. Tonometry, pachymetry, ophthalmoscopy, perimetry are some of the techniques to investigate the progression of the disease.
To lower IOP, a common therapy is to use medication eye drops. Studies have shown that by lowering IOP with prescription eye drops, there is less chance of damaging your optic nerves and losing vision.
After I was diagnosed with glaucoma, I was told that the pressure in both eyes was very high and it required immediate treatment. I continued with the medication advised by the doctor. Now it is 4 years that I have been using it and leading a normal life.
Lumigam is usually taken once before bed. But you should be sure to use Lumigam as prescribed by your doctor. To use Lumigam, first wash your hands. With your head tilted back, use your index finger to pull down your lower eyelid to form a pocket. Gently squeeze one drop into the pocket. Do not let the bottle tip touch your eye, your fingers or any surface. Now, gently close your eyes for about 2 minutes and lightly press the inside corners of your eyes. This will help keep the medication in contact with your eyes.
Data suggests skin contact with your medication may lead to side effects like darkening of skin around the eye.
Therefore, it is necessary that you blot or wipe off any excess medication that may have come in contact with your skin or lashes.
One of the common side effects of Lumigam therapy is eye redness. Increased eye redness is usually painless and cosmetic in nature. It is not a sign that anything is wrong with your therapy. Although it may be distracting to have eye redness, it is important to stay on your medication. As with any new medication, if you do experience any pain or other symptoms after taking Lumigam, you should talk to your doctor.
When I started Lumigam therapy regularly, my eyes started getting red. I was anxious to know as Lumigam has stabilized my eye pressure. My doctor had initially notified about this side effect, but still I visited him again as I was troubled. He explained to me in detail that our eyes naturally have some redness because of the presence of blood vessels. Increased redness is a common treatment-related response to Lumigam and certain other IOP lowering agents. He assured that as my eyes adjust to the therapy, the eye redness should fade. He also told me that in some patients, eye redness may continue a little longer.
It is more important for me to lower the pressure in my eye and to have a healthy vision. The doctor had already alerted me about a probable side effect of my eye redness, and that should not make me discontinue my therapy. Apparently, I could continue with my profession only with a healthy vision. My work is my passion, and I would gladly put up with any side effect like that till my eye pressure is down. Initially, I was disturbed, but that was unnecessary. Gradually, the side effect disappeared, and it has been 4 years that I am living with a healthy vision thanks to Lumigam.
Certain beliefs which restrain people from undergoing a check for glaucoma are actually myths. Glaucoma may affect even at a younger age, despite the known fact that risk of glaucoma is seen mainly with increased age. Moreover, one may be able to read very well because of his good central vision, that is 20/20, and still may have glaucoma as it affects the surrounding vision first.
Much like blood pressure, every individual has a different safe IOP level which they need to maintain. A safe IOP level will help you to preserve vision. You should work with your doctor throughout your treatment to reach and maintain your personal safe eye pressure level.
While a temporary increase in eye redness may be distracting, remember that vision loss with glaucoma is permanent. it is up to you to take responsibility and do what you can do to prevent vision loss. Reducing IOP will not cure glaucoma, but it is your best defense against losing your vision. Always remember that if you have a family history of glaucoma, then you too are more likely to get glaucoma. Hence, all the family members should get their eyes examined for glaucoma.
Always listen to your doctor's advice. Continue taking your medication as advised by the doctor regularly. Go for regular checkups as advised by your doctors. Do not discontinue medication on your own. This can cause irreparable damage to your vision. Stop progression of glaucoma. Early detection will help you save your sight and lead a normal life.